Hi, this is the first video I'll be making. I don't know if this will be something that I'll continue to do or what, but I've thought about it since the beginning of this journey, and I figured if I get started and continue, great. If I don't want to continue, I'll just delete it. So about a month and a half or so ago, I found a lump in my left breast. So, to summarize the story, I saw the doctor and he booked me for a diagnostic mammogram and an ultrasound. So I had that done, and they thought it was highly, at first they said it was suspicious, and then they said it was highly, not susceptible, highly, can't remember what it is now, but anyways, my mind is stuck on trying to remember that word. So anyways, they wanted to do a biopsy on it so that they could know for sure. So a couple days later, I had a biopsy, and all that is back, the pathology report. And I'm just going to go into the doctor and hear it. I did ask if they could email it to me yesterday so I could read through it, and they did. So I do know that yes, it is invasive ductal carcinoma. So it is definitely breast cancer, but I guess I will find out what the doctor has to say and how we go forward. I will check back with you in a bit, and wish me luck, because I'm freaked right out. Alright, thank you. Hi, so it's been a little while since I recorded right before I went in and saw the doctor to get the diagnosis, but it was a really hard day. I could tell by looking at that picture. I was pretty puffy, and I had had quite a few anxiety attacks or panic attacks or stress attacks or whatever they were, shaking attacks, getting ready to go to that appointment, and it was just a lot. So it's taken me a bit to continue with this. So when I was in there, basically the doctor come in, and he knew that I had read the report because they had emailed it to me, and he come in with his sheet, and it had his notes on there to go over with me. Basically, he just said that I needed to get referred to the Cancer Association. Next would be the hormone receptor analysis. I consult with the surgeon to decide whether or not it would need to be a lumpectomy or a mastectomy. Then they would find out if it was clear margins and could go forward, or if more surgery would need to be done. And then they would determine staging. After that, the doctor, my family doctor, said that I would need chemotherapy and radiation. And basically right before he left the room, he was really good about it all, but he said, if you want a chance of surviving this, you have to do all this. So that was kind of a big shock. So waiting now for the call from the surgeon's office to book that appointment. All right, keep me in your thoughts. Bye.